Hi friends, welcome to the Grace YouTube channel. Thank you so much for all your likes, shares, subscriptions. Yes, today is a very serious video and I want you to really listen to it very carefully. Please watch the video till the end. I would try to make it as short as possible. This is something that you need to know, especially parents need to know. This is related to COVID-19 and the effect it has on children. Actually, initially we we were in a thing like COVID-19 does not affect children much. Even though if it affects also, even though the number is less also, they get recovered soon. This was earlier what was being taught, and only the elderly are affected soon. And you might even have a question, then why are the schools closed, and why do they say like more less than 10 years are not supposed to go step out and all those things? Maybe because children, it's easy from a child to child to spread it, and they cannot wash hands. They don't know how to wash hands regularly, or they cannot stop touching their mouth, touching their nose and eyes. Okay, so that's all about. That's what was an earlier news about COVID-19. But recently there is something which is happening to children, which is connected with COVID-19. This particular thing is called pediatric multi-system inflammatory syndrome. Yes, this is a syndrome which is caused to children across the world, especially in America and also Europe. Around 147 cases and around 3 deaths have occurred in New York, especially for children from 0 to 19 years. What is this? Is this related to COVID-19? Yes, some of them say yes, it's related to COVID-19. Children who get COVID-19 do recover faster, but once they recover, they have their antibodies in the body. Antibodies help to, fight against that COVID-19, and this causes damage to the other parts of their body. So this is that syndrome. And not just that, this is also related to an earlier type of disease which is called Kawasaki, which is related to the heart. So it mostly has some effect on the heart, and also toxic shock. All these happens because of this particular syndrome. Many cases are coming out in a lot of places around the world, and they are really worried and bothered. WHO is very bothered and worried, and they are asking for the countries to give details whether such thing is happening or not. And like for example, there was a child who was 12 years old, Juliet, in New York. She went to the hospital saying that I have a stomach ache, and then she is found to have after some time she was okay, but after a point of time she had this severe, her heart rate was going down, and it was getting worse. See, my dear parents or whoever is watching this, I'm not telling this to scare you, or create a panic, or have a negativity. This is not about that. This is about awareness, that you should be aware of something like this is happening. And it is serious, and the world is taking it serious. The pediatricians and the doctors are taking it serious. So it's time that we also take it really, really serious and keep our kids as safe as possible. The symptoms that this particular syndrome shows is children might get fever for 48 hours, abdominal pain, okay, diarrhea, vomiting, red eyes, rashes in their body, red cracked lips, inflammation in their hands and legs, and also sometimes inflammation in the lymph node. So these are certain symptoms which show. Doctors are still finding out what is this something which is coming out because of, and those children who have been diagnosed by this syndrome, some of them are COVID positive, some of them are not positive also. So but this is not a spreading disease like COVID, like corona. It's not going to spread from one child to the other, but it is really affecting the children a lot, and it is related to heart, and you have some very bad things which is happening. And it's not nice to see children in the hospital with all the mask and all the in the ICU. It's not at all happening. I just thought that it is high time that I need to share this and address this and talk to you about it. Please go do a lot of research, and if you have any, so don't panic if you have one or two of the symptom like this in your child. But if you have so much, and if you think that something is not right, please approach a doctor, a pediatrician, and find some help. And so let's take this as an opportunity to keep things on track. Okay, so stay safe, keep your children safe, keep them at home as much as possible, wash hands as much as possible, keep your surfaces and your surroundings clean. Don't step out unless and until it's not very necessary. If you're going out for a very necessary job and you're coming back, please make sure very clean and you wash yourself well. And also try to create as much awareness as possible. As days pass, we feel that this is going to go down, this is going to get all right, but it all is in our hands, how we are going to face it and what we are going to do it. So this is my humble request from my side. So to all the subscribers and even the non-subscribers of this channel, so to take care of your family and take care of your children especially, because it's very hard for children. Even if they get a very small, say a fever or a cold or a cough itself, it's very hard to see them in that situation. So what if something big hits them? So we don't have that much strength, I think, to see that. So please stay safe, take care, do like, share and subscribe to my channel.